Certainly the research about the very limited research, some of the research that was done on that original pilot, for instance, back in the 1990s, and more recent research in other jurisdictions suggests that money is actually, broadly speaking, not the top priority for people when they sue the NHS. In fact, there's a certain amount of evidence to suggest that people are reluctant to sue the NHS, that they're embarrassed about doing it, and feel a bit guilty about it. And the number of times I've had people say, sadly, if only this had been handled better by the trust in the first place, I would never have thought of bringing proceedings. I felt I had to bring proceedings to catch their attention and to get them to take what I believe is a worrying and wrong situation seriously. And that's a very expensive price to pay for having a, frankly, hit and miss complaint system. And one of the things I've been really keen on trying to encourage the NHS to do is to have better processes for handling complaints, perhaps using independent neutrals to chair meetings between hospitals and patients in serious cases at an earlier stage, so that we can head off at an earlier stage and encourage people to say, well, actually, money is not everything about it. I'm really quite pleased to have that acknowledgement, rather like that woman back in 1997 who found out where her child had been buried. But I mean, money is important, obviously, and you have cases where people suffer very significant disability and they are going to need care and they're not going to be able to work and they are going to lose out unless there is compensation, and particularly children who have suffered serious birth injury, it's very expensive to care for them. But there are big controversies about that. I mean, more than half the payments out by NHS resolution are for birth injury cases, even though they actually represent probably 10 or 12%, I think, of the actual number of claims. But if a child is damaged at birth, it can be exceedingly expensive. And I certainly handled claims in excess of £20 million in those sorts of cases. So money does feature, and it has, and even a modest sum can be regarded as a sort of material recognition of acceptance. But I don't think it necessarily, except in the really hardship cases, it necessarily needs to be huge sums. Who's to say that the way we calculate damages is right? There's a lot of conventional work done as for suffering, for pain and suffering and loss of immunity. It may be that something can be done to shift that.